Pop quiz. Okay, your patient is about to have a liver biopsy. Immediately before the liver biopsy, how are you going to position your patient? Go ahead and put your answer in the comment section. Double points if you can tell me why. How do you position your patient immediately before a liver biopsy? And the correct answer is supine. That patient has to lie on their back, and not only on their back. Their right arm is going to be elevated above their head and over their right shoulder. I'm doing it wrong, but over the right shoulder. No, right arm over above their head and over the left shoulder, excuse me. And the reason for that, you can't see where I'm pointing, but on the left side where, I can't speak, on the right side where the liver is located, you need that area exposed because that's where the biopsy is going to be performed. Now, not for nothing, right after the biopsy, the patient is going to not be supine. They're actually going to be placed on their right side. And the reason for that, the liver is a very bloody organ. I mean, think about it, where your clotting factor's made. So you want the patient on their right side after the biopsy because we want to put pressure on that area and decrease the risk of bleeding. Remember, any patient that has had an invasive procedure, if it's invasive, we're always going to be concerned about three things no matter what. We're going to be concerned about infection because there's going to be a chance that we actually introduce pathogens, bacteria into that patient's body. We're going to be concerned about that patient developing a DVT, or God forbid it starts to move and goes to the pulmonary artery, a pulmonary embolism. And the third thing we're going to be concerned about is hemorrhage, right? Especially when it comes to bloody organs such as the liver. So before the biopsy, again, patient's going to be supine, right arm elevated over the head towards the left side to expose the area. But after the biopsy, patient's going to be placed on their right side to place pressure on that area to decrease the chances of bleeding.